Dr. Mark Murdoch is my name. I've been practicing for 24 years now, all in northern Utah, a small little community in Brigham City, Utah. I found CSI, gosh, maybe 3 or 4 years ago, and decided to take the leap to becoming more of a full arch doctor and learn more advanced surgeries. My first opportunity to attend the class and then the resulting surgeries was just mind-blowing and just opened up all these types of opportunities. And so I've spent the last few years trying to hone my skills, and coming back to CSI this last time, it was it's an opportunity for me to see what I've learned, and also to get to learn from some of the best doctors that you have there. So I was excited for that. A double arch is quite a bit different than a single arch, and there's a lot more pressure and a lot more in my experience. There's a lot more logistics that need to really be worked out when you do two arches in a day instead of just a single arch. And so I was excited for the challenge, and I was excited for the opportunity. Again, I was given an incredible mentor in Dr. Caldwell. She was exactly the person that I needed to give me the confidence and give me the expertise needed to complete the surgery in a timely manner. She taught me some incredibly great tricks and tips that speed up the process, and just the whole process was what I was hoping it would be, which is giving me confidence, streamlining the process, buttoning up the workflow, and getting better at it. When you have another doc like Dr. Caldwell there, but also patient selection, having the anesthesiologist there, but just the calmness of the day, that really what it does is that when you're at your own office and you're running the show, sometimes you allow the anxiety to build and your confidence, maybe something doesn't go right, and when you're by yourself, that tends to really heighten the anxiety. Now, with my double arch, not everything went perfect, and so Dr. Caldwell and I were able to troubleshoot, and I loved having that opportunity to say, okay, this is a possible problem. How are we going to fix it? Let's troubleshoot it and get it fixed. That builds confidence when you can sit and on the fly troubleshoot problems, and in the end solve those problems by someone who or with someone who has the experience to do that. That's where the confidence was built. And so now I had the expertise behind me with single arches. Tackling a double arch was not quite as difficult as it would have been. Separating CSI for other alumni, putting it into practice first and then going back to CSI once you've mastered that skill, and building on that, I think, is a way to do it. And I'd like to say that there isn't a complication or a problem. There isn't any of those that hasn't been addressed by someone at the course, one of the mentors. And so, and of course, Dr. Dune and Dr. Brisky, they're excellent at what they do. And so, like you said, safety net. It feels so good.